Good morning and welcome to your next unit. This is HLTINF001, Comply with Infection Prevention and Control Policies and Procedures. Following hand hygiene practices. Washing your hands is one of the most simplest and effective ways to prevent the spread of infection. You must ensure that you wash your hands thoroughly before and after contact with clients and contaminated activities. Think about areas that are harmful, where organisms might choose to settle in and breed. This is things such as underneath our fingernails. Hand washing procedure. So first we want to apply a disinfectant or a liquid soap, and we want to rub our palms together in a circular motion, just like so. We want to rub and lather between the fingers. So this is where we open up our fingers and we start to rub and lather in between them. We cross our hand over the top of each other and we start to go in between the fingers like so. We want to rub and lather the backs of the hands. So this is where we do a circular motion onto the backs of our hands. We place our fingers in a monkey grip and we rub together. We grasp our right thumb and our left arm and we rotate around and we repeat for the opposite. We rub the tops of the fingers and back of the palm. So this is to get underneath the nails. We also go up and around the wrist area, and we want to rinse our hands off. Here we're going to put one hand under the water at a time and rinse off. Then we're going to grab our paper towel and we're going to pat dry our hands, and we're going to either use that paper towel, our elbow or our foot to turn off the tap. So the surgical hand wash procedure is a little bit different. So hands should always remain above the elbows. Sensor or below the elbow taps should be used. So this is where we can turn the taps on using our elbows or our knees or our feet. Antiseptic soap should be applied with the hands and wrists. So these will come in individual sealed packets. So we open them up and we start to scrub around up into our elbows using our wrist and our forearm. A sterile brush will then be used to clean under the nails with both hands. This will also be individually wrapped and it's a one use only. So we use these to go in and underneath our nails, around our cuticles. Hands should be rinsed thoroughly. Once again, that's just singly washing each hand off. Antiseptic soap should be reapplied to hands and 2/3 of the forearm and washed for at least 2 more minutes. This is where we start the process again using a fresh bar, using a fresh nail brush, and we start the process again doing what I was just demonstrating earlier, but we're going to take it up to the elbow here. Then we're going to rinse everything thoroughly. So we start from the elbow and we bring it down with the water, and we start from the elbow and we bring it down. Once we're finished rinsing our hands and our forearms thoroughly, we're then going to go into the drying process. So we don't use paper towel in a surgical environment. We use more of what you would notice as a hand towel. So what we do there is we start at the hands and we work our way up to the elbow and ensure that everything is dry. We're going to use 1 towel per arm. So you will need to. So the chain of infection. So we start at an infectious agent. There's a reservoir, a portal of exit, mode of transmission, portal of entry, and susceptible host. Covering cuts and abrasions. So if we do have any open wounds, we need to make sure that they're covered. This is to ensure that we're not going to get any infection from other clients or colleagues, or we're not going to pass on any infection to clients or colleagues. So we need to cover our cuts and abrasions with a waterproof dressing. As I mentioned, this is to stop the spread of cross-contamination between patients and yourself. The dressing should be changed in between contact with different patients. Guidelines for glove use. You will need to wear gloves anytime you are dealing with bodily fluids or blood. Gloves must be disposable and are not reused for multiple procedures. Do not try to wash them, and do not wear multiple gloves at a time. Damaged gloves should be replaced immediately, and hand hygiene procedures should still be carried out before and after the use of gloves. Other procedures that we can use is by putting up posters and other visual information. Visitors should be told or inform their healthcare worker if they have any type of respiratory infection or are experiencing any type of illness. Offer masks to visitors or staff, and encourage people who are coughing to sit further away from clients. So the next topic we're going to talk about here is waste. So waste may include, but it's not limited to, clinical waste. For example, this could be human tissue or the discarding of sharps. Related waste, so this is radiographic waste, chemical or amalgam waste, or general waste, any waste that is separate from the above categories. So we have a colour coding system for our waste. So normal waste will go into black, white or green bags. Your clinical waste, which will be yellow, and it is labelled with a clinical waste symbol. Your cytotoxic waste, which is purple, and it's also labelled with a symbol. And your radioactive waste, which is red, and it also has a symbol. Transporting of waste. So clinical waste containers should be clearly labelled, and they need to be closed while they're being transported. The label should indicate what is inside and show any hazards associated with the contents. Trolleys should be fitted with drip trays for spills and cleaned daily and never overfilled. Disinfection. Disinfection is required when there are bodily fluid spills or if there is an infection outbreak. Diluted bleach is a common disinfectant. Areas should first be washed with hot soapy water before disinfectant is applied. Disinfectant can be either thermal or chemical in nature, with the former the preferred method. Own area of responsibility. For operations to run smoothly in an organisation, it is important for all individual members of the team are aware of and work within their own area of responsibility. Working with too much or too little responsibility than what is outlined in your role could impact negatively on operations and the safety of both clients and workers. Reporting incidents. So incident forms should be completed in a timely manner. The date and time of exposure, details of the incidents and how it occurred, name of the source of the exposure and the site of the injury. Identifying and separating clean and contaminated zones. So when you're dealing with a client that has a contamination, we want to have a clear boundary of what is a clean and what is a dirty zone. So clean zones may be those that are used for storage of equipment. This could be anything from your hoist to their clothing, sterile areas and administration areas. Dirty zones are maybe those that are used for cleaning areas of used instruments. So this could be of a dressing trolley or the disposal of waste through your linen skips. Lastly, in this topic, I want to speak about confinement. All materials which are used within your organisation will need to be confined to the appropriate zone. This will include records, materials and medicaments, as well as instruments and equipment. As previously mentioned, zones should be separated into two categories, being cleaned and contaminated. So once you have gone through your PowerPoint presentation and you've gone through the videos and the learner guide that is associated with this unit of competency, you will come to a set of theory questions. This will involve skills activity, knowledge activity and a performance activity. Once again, if you're experiencing any difficulty throughout answering any of these questions, please feel free to contact your trainer directly and he or she will be more than happy to work closely with you. Thanks for listening, guys. Talk soon. Bye.